Let's get to our next round of discussions. Mr. Daniel Onaji is joining me for these discussions. Mr. Onaji is a consultant radiographer here in Abuja. We'll be looking at the role of radiographers in this COVID-19 management. That's the focus for this round of discussion. Mr. Onaji, good afternoon. Good to see you.
Thank you, Gwenga, for having me.
Just how important, sorry, before I talk about how important you people are in the management of COVID-19, who are radiographers?
Good evening, Nigerians. Radiographers are a specialist group of healthcare professionals who are trained to carry out diagnostic X-ray, therapeutic or radiotherapy, ultrasound, scanning, mammography, CT scan, and MRI scan. Basically, they are the only group of professionals who are trained and licensed to administer radiations on patients in our hospitals across the country and worldwide.
Okay. So you are the people who operate laboratories, so to say?
Well, we operate X-ray machines.
You are part of those who work in laboratories?
Yes, and we also do ultrasound scan, which is very popular. And like I said, we do CT, MRI scan, and other form of medical imaging.
Are those services you offer, are they necessary requirements in the management of COVID-19, for instance?
Yes. COVID, like we all know, is an infectious disease. And the role of radiology or X-ray in management of infection disease is as old as healthcare practice. And most patients who present with symptoms of this respiratory disease basically will need to have an chest X-ray as a first line modality available in most of our hospitals. And in some cases, where it is available, chest CT scan is also very, very helpful in the management of this patient. And as radiographers, we are the experts who help, and we are also in the front line interfacing with these patients as soon as they are triaged by the doctors or in any emergency room or emergency department in our hospitals. So basically, we are frontline staff who are involved in diagnosing these patients, apart from laboratory testing, which is very common. X-ray, chest X-ray, and CT scan, where available, has also been very, very helpful in diagnosing and treating COVID-19.
So you people are essential part of the treatment chain for COVID-19.
Exactly.
Since Nigeria's case with COVID-19 started, have your members been playing these roles? Have they been involved, or they've been sidetracked?
Thank you, Benga, for that question. My Association of Radiographers of Nigeria, in partnership with the Radiographers Registration Board, has designed a protocol which we expect to be integrated into the entire management chain of patients infected with the coronavirus. We have not been fully represented as you would expect, or we would expect. The only exception, which we are grateful for, is the health secretary in the FCT management that's taking on board a few radiographers. We would ask for more, because in the management of this very novel virus, the use of portable X-ray machine is very, very helpful in looking after these patients in accident and emergency or in our hospitals as soon as they are looked at by the doctors. I wouldn't say that we have been given our rightful place at the moment, and this is why we are appealing to the NCDC to try and integrate more radiographers and bring them on board so that we can play our role, so the patients can also get the best benefit of diagnosis using chest X-ray or CT scan where they are available.
So if you're asking them to integrate, where particularly do you want to be playing? At the testing centers, in identifying the contacts, the true symptoms, or where precisely do you want to be situated within, along the chain?
We have a great role to play in the chain. from the surveillance, for example, surveillance, at the level of surveillance,
You think you can feature
yes,
there?
we are very, very important. We are very key when the surveillance is being carried out. For example, we would expect that we should have, as part of the NCDC deployment, mobile radiology units, like mobile scanners equipped with X-ray and CT scanner. I'm talking about equipment mounted on trailers that can be at the beck and call of the NCDC, such that if they activate any team for a particular state, and they think that they're going to be dealing with massive triage, we would expect them to deploy this mobile X-ray machine or mobile trailers. Unfortunately,
we're doing almost house to house.
Exactly.
Search now.
Exactly. House to house.
They call it active case search.
Yes, active
in communities and all of that.
Yes, the active case search and surveillance.
Yes.
Unfortunately,
how? Can you explain that?
Yes, we have. There's only one company in Abuja here, unfortunately, that has mobile X-ray machine mounted on a trailer and mobile CT scanner mounted on a trailer that could have been part of the NCDC. My check reveals that they haven't been engaged. And I think that the reason why this sort of very vital equipment that should have been part of the NCDC deployment has not been engaged is because radiographers have not been given the desired attention and role extension that they need to be given. If that were so, most of the challenges we're having with results delaying, so many countries like China and US, when this started, they brought in radiology equipment, which has been helpful. Because in the absence of molecular and laboratory testing, you could do a chest CT where you have them. Basic X-ray, yes, but it's probably not as sensitive as a CT scan. So in line of this setting up what we expect to be deployed in surveillance, chest CT scan, chest CT can be very helpful in the absence of laboratory testing. Basic chest X-ray is helpful, but probably not very sensitive or helpful at the early stage of the infection. But in patients with any form of complication or complicated management, you need to have a CT scan that monitors whatever symptoms they develop along the line if their situation get very critical. And that can be very, very helpful.
So what is the advantage of this mobile system? That
the advantage of this mobile
system?
Maybe
in the sense that it can attend to many people at a time. Because if it's mobile, that means you can drive it to a community.
Exactly.
Can it since it's a scan, for instance,
yes.
Can it attend to more than one person at a time, or what?
Well,
or is it in terms of the return rate, the period within which you conduct the test and when you get the result?
Basically, it's when you do an X-ray.
Where precisely lies the advantage?
The advantage is in the fact that instead of the patient coming to the facility goes to the patient.
Okay.
And
they can move from
one location to the other. So more than one community can have access to this facility when they do need it. And that can be very, very helpful. First, it brings down the cost of acquiring this equipment. Secondly, it is easier to disinfect. Because you move from one community, you disinfect, you go to another community, and it's easier because you are not moving the patient, you are not moving the hospital, you are moving the equipment to the locations. If you were to have an infection in a community and you have the doctors and all the NCDC package ready, if you need to have like a mobile CT scanner, this will be very handy because you move it to the location, you disinfect and move to another location. So in terms of cost, you don't have to buy the same CT scanner for all the states. You can have one equipment that serves more than one state, depending on when their need comes up.
Okay. Let's talk in terms of numbers now, because we know that what this COVID-19 has brought out of us is to show us, is to serve as a mirror and reflect our true image to ourselves, which is to reflect how very decrepit our health system is in Nigeria. We'll have shortage almost in everything, even including medical personnel and all of that. I just want to ask whether if, for instance, now, attention is beamed on the roles that radiographers should play in the management of COVID-19, do we have enough radiographers well trained for government to call upon that, okay, guys, come and join in this fight?
As well, radiographers are not exclusive to brain drain that has hit the health industry. But I can tell you at the moment, we have enough radiographers in Nigeria that can be deployed to help with COVID-19. And we have radiographers who are willing and ready to be part of the NCDC or the state government plan to deal with this condition. The challenge we have, basically, we are in a war situation. And the best way to prepare for war is in peacetime. As you may know, our health system has been neglected over time, and it's taking its toll on every aspect of our healthcare delivery, including radiography practice. And most especially in our case, over time, we have had radiology equipment, radiography units not functioning optimally because of myriads of problems in the healthcare sector, from procurement of equipment where radiographers are sidelined, to hospitals and government buying the wrong equipment and installing this equipment the wrong way, and over time, the equipment, most of them are moribund and they are not working. These are problems that can be improved upon by engaging with radiographers who should be part of the decision-making in procurement of this equipment, in managing this equipment, and in ensuring that they last longer because people with the right expertise are operating them. But we have a situation in Nigeria where, unfortunately, doctors are involved in purchase and procurement of X-ray equipment, and radiographers who are the operators, who know how to operate this equipment better, have been sidelined. That takes its toll on the product, the result, the benefit that we get each time or the few times that we have attempted to buy the equipment. So the issues that we have are that we got the wrong equipment, the wrong people operating them, and wrong service contract, because the people who know how to use this equipment or who use them on the daily basis are not involved in the procurement process. These are parts of the challenges.
Okay, I understand that. But again, if radiographers are drafted to this battle, maybe in an attempt to put more hands on the deck, do you think they will also be as they will be facing the same risk that other healthcare providers face?
As I speak to you, radiographers are frontline staff in the management of COVID-19 all over the world. You may recall that when Boris Johnson was in hospital, he was so much he had so much contact with radiographers that he placed special emphasis on the way he was treated, from his admission to his discharge. Yeah. We would play a very vital role if we are engaged, because you find out that all over the countries that have really improved their health systems, you cannot run any hospital without radiographers. And at the forefront, you find that because we are frontline staff, we are exposed to a lot of risk. I suspect to you, my check revealed that a few radiographers have tested positive in Lagos as part of the daily exposure risk that they are exposed to. And this is especially, everyone who is involved in healthcare practice knows that the risk level everybody is a risk. As long as you're a healthcare worker,
including even cleaners.
Yes, in cleaners are even, you'll be very surprised that
they're the ones who touch the disposables.
Yes, and they seem like they seem like the weakest link, but they are the strongest and most important. So from the receptionist to the cleaners, everybody has to be properly protected. And because most of these people, frontline means that those who come into contact with patients, radiographers cannot do X-ray remotely. You can't do ultrasound remotely. You can't do CT scan remotely. So we come into contact with the patient on a daily basis. And we should be considered as frontline staff, and should be considered in terms of whatever protection that is supposed to be given to every other person in the healthcare sector. And also compensated accordingly, because our own hazard, apart from radiation hazard, we are also exposed to this sort of hazard because our own care demands us coming into physical contact with the patients.
All right, last set of questions. Nigeria has recorded 1,095 cases. A lot of people will tell you that this is just nothing compared to what our actual situation will look like if only we are testing.
Correct.
We are not testing. As at this morning, I listened to the DG of the NCDC, 10,500. That's how much we have tested.
Yeah.
With just 14 laboratories. And the 14, I think it's just up from 5 to just this 14. South Africa, that is less than 1/4 of Nigeria's population, has tested over 100,000. Ghana has tested over 70,000. Nigeria, the big brother of Africa, with close to 200 million people or more, has only tested 10,500 as of this morning. So our case will probably be reflected more if we are doing more testing. And it is because testing has actually been scaled up in the last 1 week or so that the figures are rising now. So what should we do?
Well, we were in a pandemic, and a lot of things we have to improvise.
Because the figures give us false hope that,
yes,
we are okay.
Now, everyone knows that the testing figures are just cannot only give you an idea of where we should be. I think that anybody who wants to treat this figure seriously should be doing a lot of extrapolation, because it doesn't really tell us the picture. We're not testing enough. Our testing centers are not working. We don't have test kit. The people are not coming forward for testing. For all that I care, I think that the most important thing I'll be looking at is the death rate.
32?
Yes, it's a death rate. Are many people dying in Nigeria? That's probably the figure to look at. In terms of testing, we are a non-starter. We are not there. We are not testing enough. Our testing centers are not working the way they should be working. We all understand the challenges, but I think that we should try and keep our focus on how we can improve capacity in the hospitals, improve capacity of healthcare workers to be able to move to the field. As I speak to you, apart from FCT, I don't know any state that has engaged radiographers, for example.
Not even Lagos?
Yes, no. I don't know.
Not even Lagos?
Probably Lagos. I'm not quite sure. But I don't know whether the hospitals, the patients that tested positive because they were part of the state engagement or NCDC or in the course of their routine job. That's what I don't know. But all I'm telling you is that in terms of engagement of healthcare workers to be able to have the maximum benefit of COVID-19 for all Nigerians, we need to engage more of the professionals and improve capacity in terms of testing, in terms of facility. We can't be here and then you probably can't see us trailing the world. In terms of disease surveillance, COVID-19 will come and go, but the truth of the matter is that we also need to focus on possible research data, because there's what we call incidental finding in radiology scan or whatever modality you use. Yeah. We need this data now so that we can use it as a baseline to compare it with future things. So don't say, oh, we don't need to x-ray patients. We need to do this x-ray. We need to do this CT scan. If not for patient treatment now, it could be helpful in further management as a baseline statistics or data when in the next 2, 3, 4 years, we don't know what's going to happen in the next 2, 3, 4 months. And we need data. We need to be building this data. So it's not only for this diagnosis or equipment or modality should not only be necessary or used for patient treatment, it should also be used as disease surveillance. Okay.
All right. Thank you so much, Mr. Onaji. Really appreciate your time. Mr. Daniel Onaji.
Thank you, sir.
Correct. Mr. Daniel Onaji is a consultant radiographer based here in Abuja. He has joined us as we look at the role of radiographers in the COVID-19 management. And of course, he spoke at length as to the fact that radiographers have not been given their due recognition yet, even though they play a very significant and very important role in the management of COVID-19. Thank you so much, sir. We appreciate it.
Thank you for having me.
All right, let's take a quick break.